That fall wouldn't have happened if you were doing what you're supposed to do. You're lucky I'm even letting you come to this appointment anyway.
I'm really worried about the baby. My life really hurts.
You know, just shut up and let me do the talking, and you better not say anything.
So, Holly, how are you? And Max, great to see you. So, you're here for a non-stress test. That's great. How's everything going for you guys?
Everything's going good. It's going awesome. She's fine. I mean, she's basically fine, right? You're fine. I mean, and she's fine.
Well, that's good to hear. So, do you guys have any names picked out?
Well, yeah, I was thinking Max because, well, he should be named after his father. There's no questions asked about that.
So, okay, what names were you thinking, Holly?
Oh, I like the name.
Well, it doesn't really matter what she thinks. I mean, I basically have all the say there is in this house. The man's the head of the household.
I see. Sir, can you please stop interrupting Holly?
I was just answering the question. We're both involved in this kid's care, aren't we, lady?
Well, yes, of course you're both involved. But...
Sir, I'm gonna have to ask you to leave so I can speak to Holly alone. Honey, I'm gonna be right back, alright? I'm just gonna be right outside. Max loves you. Okay? Yeah. Alright. I'll be back. Okay, Holly, sorry about that. I just wanted to get, you one-on-one for a second here. So, you said that you had a fall last night, is that right? Can you tell me a little bit more about that?
Yeah, I'll be honest, he had a little bit too much to drink. He got laid off from work yesterday, and he was stressed, and he accidentally bumped into me, and I fell. I rolled my ankle, so.
Has this ever happened before?
No.
Okay. That must have been tough. Are there times that you're ever afraid of your partner? With your partner?
I do feel safe. I'm angry, upset with him right now, but
okay.
I know that if anything were to ever escalate, I would leave.
Okay, that's good to know. Thank you, Holly, for sharing that. Now I guess we can talk about what you're really here for, that little one coming. Are you excited? Good. That's so exciting. Okay, Holly, what we're going to do next, we're going to do a quick little exam here. I just want to take a look at your face, so is it okay if you just remove those sunglasses for me real quick?
The lights in here give me a really bad headache.
Yeah, I understand that they definitely could give you a headache, but we're just going to take them off really quick so I can do a quick eye assessment, and then we'll be good to go from there, okay?
Oh, all right. I guess that's okay.
Holly, when I see injuries like this, I wonder if somebody could be hurting you.
No, no one hurt me. I'm just clumsy, and I was playing softball the other day, and the ball slipped out of my glove and hit me in the face.
Okay, Holly. Well, is it okay if I just take a quick look? I just want to make sure that everything's intact.
Okay.
Have you been putting any ice on it?
A little bit.
Okay, well, I'm just going to check and assess the damage here, okay? Holly, this looks rather serious to me. I think you might need stitches.
It doesn't hurt that bad.
Holly, this is really serious. I think you might need stitches. Let's put this Band-Aid on here, Holly. Okay. Okay, Holly, after the assessment here, I mean, I'm gonna send you to have your eye stitched up. You appear to have a laceration on there. I'd like to get some more background information. I need to let you know, Holly, that everything we say together today is going to be confidential. But if you've been physically abused, I'm required by law to report that.
Okay.
Is it okay if I begin asking you questions.
Yep.
How are things at home, Holly?
Things are okay.
Okay. How are you and your partner relating?
Okay. Pretty good.
Okay. Can you elaborate on that at all?
There's a little tension every once in a while, but
Yeah. Well, I mean, right now, honestly, you appear to be a little anxious and nervous. I just wanted to know if everything was all right at home.
things are okay, but my boyfriend and I get in arguments every once in a while, and he gets angry with me.
Are there ever times you're afraid of your partner, Holly?
On occasion.
Holly, I want to let you know that you are in a safe place, okay? And there are resources that can help you.
Okay, I wasn't telling the truth. I didn't get hit with a softball.
Okay, do you want to tell me what happened?
My boyfriend got angry, and he had a little bit too much to drink, and he swung at me.
That must have been very frightening for you, Holly.
It was.
I know it must be difficult talking about this. You're very brave. And you know, nobody deserves to be treated this way.
He makes me very nervous because he's always on edge, and I never know when something's going to happen.
I'm very glad that you're able to tell me about this, Holly. You're very strong. Holly, do you have a plan of action in case you need to get out? Do you have a safe place to stay?
I could contact my coworkers, I guess, if I had to, because they've been asking me if things are okay. And my friend Margaret, she lives pretty close by, and she's concerned about me as well.
Okay. Is the abuser ever under the influence?
Occasionally, yes.
Okay, what kind of substance does he use?
Mostly alcohol.
Okay. And how frequently does he use alcohol?
I'd say about 5 to 6 nights a week.
Okay. Does he have a weapon?
He has a gun in the house.
Okay. I know it must have been really difficult for you to tell me about this, Holly, but I'm really happy you did, because there are resources out there to help you. I'm going to give you a couple resources here today. We have a couple pamphlets here that I'm going to give you, Holly. You can feel free to look at these. These are some resources in the area. So go ahead and feel free to take any of these. I have a crisis number, and I have tons of shelters in the area in case you don't have a safe place to go. And I also have a victim assistance number. But Holly, I'm very concerned about you going back to that home today. And like I told you, I'm mandated by law to report the abuse. Okay?
Okay.
Okay. Yeah, I understand that they definitely could give you a headache, but we're just going to take them off really quick so I can do a quick eye assessment, and then we'll be good to go from there, okay?
Oh, I guess that's all right.
Holly, I just want to let you know that everything we say here is private, but if you're being physically harmed, I'm going to be forced to report it, okay? So I'm assuming that you're being abused. I mean, your black eye, your scrapes all over you. You need stitches, Holly. I mean, what would make your partner hit you? What did you do? Holly, why would you ever stay with a person like this? Seriously. Holly, you have to have more common sense. You just need to get out. Just leave him. Leave the dirtbag. Have you thought of ways that you can avoid getting hit? Holly. And he uses substances, I'm assuming? He must have a weapon in the house.
He has a gun in the house.
Holly, you need to get out. You need to get out. I'm going to tell the police everything. Yeah, I'm going to tell the cops everything. So things at home, I'm assuming, are pretty rough. All right. Your partner and you probably aren't relating well, I'm assuming. Look at your eye. You're bleeding from the nose. You have scratches all over you, Holly. I bet you're always afraid of your partner. You must be. Look at your face. You're a train wreck, Holly. You need to get out. I can't stand seeing patients like this who don't have the common sense to leave. Holly, you need to get out. Do you have a place to go? If you don't have a place to go, I mean, I got some brochures and stuff. But Holly, just get out. Get out as fast as you can. You don't deserve this. Nobody deserves this, Holly. Jesus. Ditch him and ditch him. Ugh. See way too many of you young women these days with terrible men. You need to own up to your own consequences, Holly. Get him back. It's not your fault. It's his fault. Make him pay, Holly.